Hey everybody, thanks for tuning in to this episode of CyberMD. Today we'll be discussing systolic heart murmurs as they apply to the USMLE STEP 1 exam. A systolic murmur is a heart sound heard during the systolic phase of the cardiac cycle, which is the period of time when the ventricles contract and pump blood out of the heart. Systolic murmurs can be caused by a variety of conditions and can provide important diagnostic information about the heart and its function. Aortic stenosis is a condition in which the aortic valve, which is located between the left ventricle and the aorta, becomes narrowed, making it difficult for blood to flow out of the left ventricle. The left ventricular pressure increases, which leads to hypertrophy and eventually may cause left ventricular dysfunction. This can cause a systolic murmur that is heard best at the second right intercostal space, and it may radiate to the carotid artery. The murmur is usually harsh, characterized by a crescendo-decrescendo pattern, and can sometimes be associated with a thrill, that is a palpable vibration, at the base of the heart. Imagine pushing a normal blood volume through a smaller hole. The crescendo is the initial bolus of blood that is forced through the narrow lumen at higher than normal pressures needed to overcome the stenosis, causing turbulent flow. The decrescendo may be thought of as the later portion of blood flowing through and slowing down as the stenotic valve has already been forced open and the force of the left ventricle is quote-unquote decreasing as systole comes to an end. Aortic stenosis can be caused by a variety of factors such as congenital heart defects, rheumatic fever, or a calcified aortic stenosis. Calcified aortic stenosis is the most common form of aortic stenosis in the elderly population, typically with an age greater than 60. If a younger patient has aortic stenosis, you may want to consider a bicuspid aortic valve. Mitral regurgitation is a condition in which the mitral valve, which is located between the left atrium and left ventricle, does not close properly, causing blood to flow back into the left atrium during systole. This can cause a systolic murmur that is heard best at the fifth left intercostal space near the apex of the heart and may be described as radiating to the axilla. The murmur is usually holosystolic, which means heard throughout systole, blowing, and can be louder at the end of systole. Mitral regurgitation can be caused by a variety of factors such as congenital heart defects, myocardial infarctions, rheumatic fever, or mitral valve prolapse. Tricuspid regurgitation is a condition in which the tricuspid valve, which is located between the right atrium and right ventricle, does not close properly, causing blood to flow back into the right atrium during systole. This can cause a systolic murmur that is heard best at the lower left sternal border. The murmur is usually holosystolic and blowing, similar to mitral regurgitation. Tricuspid regurgitation can be caused by a variety of factors, but is often due to dilatation of the right ventricle, which stretches the valve leaflets apart. Ventricular septal defect, or a VSD, is a congenital heart defect in which there is a hole in the wall, or the septum, between the right and left ventricles. This allows blood to flow from the left ventricle to the right ventricle during systole, which can cause a systolic murmur that is heard best at the left sternal border, usually in the tricuspid area. The murmur is usually harsh, blowing, and can be louder with inspiration. VSD can cause increased blood flow to the right side of the heart, leading to right ventricular hypertrophy and eventually right heart failure. One important note is that usually large VSDs are much lower in intensity than small VSDs. This makes sense intuitively as the turbulence will be much greater if the blood is being forced through a smaller hole. Mitral valve prolapse is a condition in which the mitral valve bulges into the left atrium during systole. This can cause a systolic murmur that is heard best at the fifth left intercostal space near the apex of the heart. The murmur usually begins mid-systole and is often accompanied by a clicking sound. Following this click, there may be a crescendo murmur to S2. Mitral valve prolapse is usually benign and not associated with significant regurgitation volume. With that being said, the presence of mitral valve prolapse may predispose a patient to developing infective endocarditis. Additionally, the etiology of the condition may be chordae rupture, degeneration due to connective tissue diseases, or rheumatic fever. Again, it's considered a common benign condition, but may warrant further workup in the right clinical setting. In summary, Systolic murmurs are heart sounds heard during the systolic phase of the cardiac cycle. They can be caused by a variety of conditions such as aortic stenosis, mitral regurgitation, tricuspid regurgitation, mitral valve prolapse, and ventricular septal defect. Each of these conditions can have different characteristics and locations of the murmur and can be caused by different factors. It's important to note that these murmurs can often be accompanied by other signs and symptoms that can aid in the diagnosis. Proper diagnosis of these conditions requires a thorough history and physical examination, as well as additional testing such as an electrocardiogram or echocardiogram. Thanks for tuning in, and don't forget to subscribe to our content.